All right. Hi, everybody. I think we have a pretty good crowd here today. It's great to see you. My name is Erin Griffith. I'm the educator here at the Silver City Museum. Just want to thank you for coming out today. We have an amazing guest. We have Dr. Montoya. He has been practicing in this community for a long time, and during that period of time, he has also become a little bit of a historian on the subject of medical history in Silver City, and we are thrilled to be able to see and hear some of this wonderful information from him. Before we get started, I want to thank a few people for coming today. They're Dr. Montoya, of course. Also, we have Joe Lutz, who is here, and she'll be helping me moderate. You may recognize Jo. She is our volunteer coordinator, and also she does an amazing job on the marketing and promotion and getting the word out on all of this stuff. So if you have any questions throughout the course of this program, please use the chat box. You can find that on the bottom. It looks like a little chat bubble, like a comic book bubble. If you click on that, it'll pop up who's here and click on that name, or you can just broadcast to everyone. You can ask us a question and we'll be happy to answer that for you. And Joanna will be helping. Also, before we start, I also want to thank Melody Collins for having stepped in here in a last minute emergency and been my eyes and ears and hands over at the museum and helping walk us through some of the more physical aspects of this. And she's just done a fantastic job, and I just want to thank her very much. She is also the buyer and manager of the store, the Silver City Museum, which has some amazing one-of-a-kind items that will be available for sale soon on the Silver City Museum Society website. We'll put that link up for you. And also, if you have any questions about the store or items that you would like to purchase, you can also email her at store@silvercitymuseum.org. And we'll also have that up available for everyone to see. And we'll put it in that chat box there. Before we start, I just want to remind everybody that all of our programs at the Silver City Museum, even when we were doing them live, are free for the whole community to attend at any time, but we do request a $5 donation if possible, or whatever you can afford. Like everyone else, we're going through some really hard times right now, and with funding cut from everywhere, your donations are really one of the things that we rely on to keep going, to keep staff paid and able to have events like this going on and offer them for free to the community. So if you can, if you'll visit the website silvercitymuseumsociety.org/fundraising, Joe has put that up in the box right there. You should be able to access that and make some sort of a donation via PayPal. We really appreciate it. It really helps us just keep things going. And if you can't afford to donate today, or for whatever reason, maybe you want to come back later, then really we're just so appreciative to have you show up here today. Just having your attendance and your voices be heard is the best thing that we could possibly hope for. So we are thrilled that you decided to show up. A little bit later on in the program, I will be putting up a poll that requests that you guys answer when you get a chance. And it's mostly real quick, multiple choice, but this is the information that lets us know if we're doing a good job, what we need to improve on, and how we can keep offering what you want to see and when you want to see it. So please fill that out, real quick, multiple choice, and we'll get that. Also, if you have any questions, concerns, or comments, please email me. My email is education@silvercitymuseum.org. And we also, when you registered, there were some options that you might have seen to join the Museum Society or to volunteer or get information. So if you didn't get yourself on there and you change your mind and want to later, just message me or put it in the chat box, and me and Joe will pick up on that and let us know. And I think that's all of the housekeeping. I think that's all of the big stuff. So I just want to say We are very happy to have Dr. Montoya join us again. He did such a fantastic job at the Territorial Charter Day event where he spoke about the Territorial Charter, that we thought that he would be a perfect man to give us a little bit of information on medical history in Silver City. We have a few items in the museum proper that really show and highlight a bit of the more interesting aspects of the medicinal practice that took place in the 1800s. So I'm really excited about hearing a little bit more of that. And here we go. Without further ado, Dr. Dawn Montoya. Thank you, Dr. Montoya. Go ahead.
Good morning, everybody. Erin, thanks for that great commercial and introduction. 150 years ago, Silver City was a mining camp, and over the next 10 years, it evolved into a community that had all the ingredients of a community. It had grocery stores, dry goods store. Obviously, it had the mills and the mines, had banks. The telegraph had come to Silver City, and there was very prominent individuals that enhanced the growth of the community. So what I'm going to do is give you one aspect of that town growth, and that is, so we'll talk about the doctors, midwives, and quacks in medicine in Silver City in the 1870s. The primary source of this presentation are from Silver City newspapers between 1870 and 1880, like the Mining Life, the Herald, the Grant County Herald, and the New Southwest, and primarily an unpublished manuscript entitled with Pick and Shovel, An Early History of Grant County, New Mexico. To better understand the health system in Silver City during this time frame, I will first tell you some important and monumental historical medical developments up to that period of time. Prior to the development of anesthetics and any attempted surgery resulted in barbaric torture, with death being the final outcome. The dentist William T. Morton used protracted development of sulfuric ether as an anesthetic, a colorless, pleasant smelling, but flammable gas, as we know it as ether. On March 30th, 1842, he used it for painless tooth extraction. And then on October 16th, 1846, surgeon John Warren extended its ether's use by successfully and painlessly removing a neck tumor from a patient at Massachusetts General Hospital. 15 years prior to all of this, an American chemist, Dr. Samuel Guthrie, while attempting to develop a cheap pesticide, combined whiskey, didn't give the brand, and chlorinated lime that produced a colorless, sweet-smelling, non-flammable liquid called chloroform. I guess what you did in those days, you just mixed stuff together to see what came out and to see if it was worthwhile. So you did get chloroform. James Young Simpson, a Scottish obstetrician, used this chloroform in 1853 during the delivery of Queen Victoria's 8th child, Princess Leopold. And by doing this, he gave credence to chloroform, that it was a safe anesthetic to be utilized. However, it took many anesthetic deaths before the appropriate dosage was finally determined. Military doctors used ether extensively during the Mexican-American War in 1846 to 1848. Chloroform became more popular during the time of the Civil War, 1861 to 1865, because of its safety and fast-acting nature. So by now, anesthetic problem was solved, but the next problem was post-surgical suppuration or infection or pus formation, which led to many deaths. After reading Louis Pasteur's germ theory papers in 1865, Joseph Lister initiated the use of 5% carbolic acid solution to wash the surgeon's hands before doing any surgical procedure. And many years later, rubber gloves were introduced. So how were these doctors trained prior to 1820? In the United States at this time, there were no medical schools, so training was primarily by the apprenticeship system. However, many doctors went to be trained in Europe, and on their return to the United States, this new training formally guided them to the establishment of American medical schools, and eventually led to strict standards and licensing that was enhanced by the American Medical Association. This was a basic state of medicine and surgery in the United States at the time of the founding of Silver City in May of 1870. The mining town of Silver City was established by John Bullard, who discovered silver, rich silver deposits immediately to the west of town, drawing miners and prospectors from the local gold and copper mines. But it also attracted people from Utah, Colorado, and Texas. And it is amazing and fortunate for us that in August of 70, just a few months after its founding, a United States census was taken in this remote corner of the New Mexico territory. However, there was an 1860 census taken in Pinos Altos, which is a gold mining community just a few miles north of Silver City. So this people were aware that Silver City did exist in August of 1870. That first census enumerated 80 individuals, and by the next census 10 years later in 1880, the population had grown to 1,300 people. So as I said, over that 10-year period, a well-governed community was established. So now we have two converging forces: the current state of medicine and the early beginning of Silver City. So just imagine what would happen if you, as an individual, developed acute abdominal pain, nausea and vomiting, or flank pain and bloody urine, or if you were a pregnant lady and you started to bleed preterm, and who was going to deliver your baby. These were very significant, potentially complicated clinical presentations that could force you to endure unrelenting, excruciating pain, and or the underlying pathology would possibly cause your death. During the hostile and active military engagement against the Native Americans, primarily the Apaches, Fort Bayard, approximately 10 miles to the east of Silver City, was formed in 1866 to protect the surrounding mining and ranching communities. By 1868, Fort Bayard had the first military hospital in the Southwest, initially under the direction of Colonel David L. Huntington, with Jason A. Grogg, a 30-year-old, acting as assistant surgeon. The first census in 1870 taken at Fort Bayard also lists the following supporting hospital staff: Alvina Arroyo, a hospital matron, age 37, who was born in New Mexico. She was the wife of one Arroyo, a very competent and famous Indian scout for the military. Additionally, there was Charles Harcourt, 29, worked as a hospital steward. He was from England. And Morris Illig, age 45, he was a nurse from Saxony. And Louis Neheran, 25-year-old from Prussia. The hospital's primary focus was to treat the injuries sustained during these military encounters with the Apaches. But they also took care of the entire military cadre at Fort Bayard. In reviewing the census of Fort Bayard, about 70% of the enlistments were individuals that had emigrated from primarily Eastern European countries. And as time progressed, we'll see that the military hospital eventually became engaged and served in supporting the growing population of Silver City. But when these civilian doctors, but who were the civilian doctors practicing medicine during this period of time in our local community? As I said, we can only find these answers by looking at the census and the early newspapers. The first doctor that we find in the 1870 census was Dr. John G. Town. He was 45 from Rhode Island. Aside from this information, we know nothing else about him. We don't know if he was here to practice medicine or to take care of people, or if he was more interested in striking a mining claim. Because of his age and coming from the northeastern part of the country, we may take the liberty and construe that he very well may have been an abolitionist and may have served in the Union as a doctor during the Civil War. So again, we don't know why he was here, how long he stayed, so he's essentially lost to history. Between 1870 and 1890, Silver City had several medical doctors and 2 dentists. Again, we have to rely on our scanty information. So one of the dentists was a 44-year-old M. Ferry from Virginia, whose parents had emigrated from France. The other one was a 21-year-old Harry W. Smith from Michigan, who probably was an apprentice dentist, or perhaps a make-believe dentist because of his young age. Who was going to check on him? The other there were 4 doctors who are mentioned most frequently in the local newspapers. They were Dr. Maynard H. Kaysen, he was 54 from Delaware, who maintained his office and his residence at the corner of Texas and Yankee Streets. According to mining claims records, Dr. Kaysen was heavily invested in mining and numerous claims. The second one was a widowed Dr. Lewis Keenan. He was 51 years of age. He was from Georgia. And as we will see, he was a highly regarded and respected physician, and we'll have more to say about him in a few minutes. The third doctor was Henry Woodville, a 30-year-old from Prussia, who came to Silver City in 1878. According to the newspapers, he married in 1880s, and his residence and office was at the Exchange Hotel. After graduating from Medical University of Maryland in Baltimore in 1865, he had further training in Paris, France. He served as a surgeon in the Red Cross section during the Franco-Prussian War, 1870-1871, and also a short time in the Carlist War in Spain. In addition to being a well-respected surgeon, he, along with Mrs. John Miller, a leader of the Ladies' Hospital Aid Society, a sewing circle, and together, at a later time, they organized and staffed and founded the first hospital in Silver City. Dr. Woodville died on December 14, 1893, and is buried at the Masonic Cemetery in Silver City. Dr. William M. McLean Sloan came to Silver City in 1881. He had been head of a Cincinnati, Ohio hospital and served as a post surgeon at Fort Cummings, New Mexico for a time. Dr. Sloan has the distinction of having performed the first abdominal surgery at the newfound Ladies Hospital in Silver City in 1883. This is how the operation is described in the newspaper. I quote, "A 4-hour procedure to repair a ruptured bladder. The patient lay on a common table with a liquor dealer administering the chloroform and a member of the sewing circle holding a mirror to reflect the light," close quote. This injury probably occurred while riding horseback. The horse must have bucked, and the pommel of the saddle struck the rider's lower abdomen, causing a rupture of the bladder. The lady apparently survived. Dr. Sloan died in El Paso, Texas in 1892. The other Prussian physician residing at the Exchange Hotel was A.H. Kellenberg, age 40. He's not mentioned in the newspaper in a medical capacity, but only by submitting mining samples and assays for his claims. There was a pharmacist and respected citizen with the moniker Doc. Age 50, George Bailey was the first druggist who served in Silver City. He was also the first postmaster in town. There were other doctors that migrated in and out. They stayed a short period of time, didn't, for whatever reason, they left. For our discussion and our time period, I have presented the current medical advances for surgical anesthesia, antisepsis, and wound care. And in Silver City, we have been introduced to the earliest medical providers. In addition, as we proceed through this discussion, we have to keep in mind that there was no such things as antibiotics, X-ray, or any other medical marvels compared to today's standards and medical advances. One has to admire these courageous physicians and also have some sympathy for the patients that they took care of. Overall, the newspapers do provide us with some of the injuries, ailments, births, and death notices, with few obituaries that give us a clue to some of the causes of death. In some cases, a specific doctor is mentioned in treating a particular individual. So what did they treat? At this time, the only mode of transportation for everybody was horse, mule, donkey, buggy, wagon, and stagecoach, contributing to a variety of accidents, resulting in serious trauma that in some cases led to death. It was almost common for male adults to carry sidearms, leading to innumerable serious accidental gun injuries and even deliberate deaths. For example, a drunken Mr. Campbell refused to surrender his gun to the authorities. He fired his weapon and struck Mr. Kelly, an unobtrusive spectator, in the left thigh. Kelly died of the wound 5 days later. Alcohol and gambling provided the vehicle for gun injuries and killing in the 7 or 8 of the frequently visited saloons. On the other hand, if a gun accident happened outside of Silver City, say in San Lorenzo, 33 miles away on today's roads, by the time the doctor got to that person or the patient was brought to the doctor by wagon over primitive roads, death by exsanguination may have already occurred. As we know, blood transfusions were in the future. Besides, if it had been an abdominal wound, there was not much for them to do. Mining and milling were the principal Silver City industry, and the backbone of the local economy that contributed to its own type of special injuries related to dynamite blasts, falling rock, mine collapses. These injuries were of traumatic nature. The mill used heavy, crude oral crushing machinery that caused crushing injuries. The ore was smelted in hot cauldron with wood-burning furnaces with chemicals added, and this triggered burns of various degrees. With these hurtful injuries, the doctors had to be well-versed in treating burns and bone setting, which was primitive at best. Dr. Kesson is mentioned setting a child's broken arm sustained in a fall. In some fractures, for example, that were compounded, meaning the bone penetrated through the skin, this injury definitely increased the rate of morbidity and mortality as a result of injury. Consideration of any safety measures in the mines and in the mills was far removed. Let's take example of appendicitis. The first successful appendectomy in the United States took place in 1886, and that date depends on who you read. So if you developed appendicitis during this period of time, there was a high probability you were going to die from appendiceal rupture, causing sepsis and peritonitis. This high mortality rate also included other organ structures like the gallbladder, an ectopic pregnancy, diverticulitis with perforation and abscess formation, and many others. Traveling on horseback during winter had its serious dangers. For example, Mr. William Eccles, during a February 15, 1879 snowstorm, Mr. Eccles took the wrong turn on his trail coming from Mimbres, 37 miles away, and arrived in Silver City in a hypothermic state with frost-bitten toes on his right foot. Dr. Henry Woodville amputated that portion of his foot, including the toes. There was no mention of anesthesia being used. Dr. Woodville probably didn't need any as the toes were dead. Apparently, Mr. Eccles did survive because several weeks later, the newspaper mentioned that he was getting along well. The newspaper published frequent birth notices indicating normal birthing process did occur, as we would expect. The births took place in the patient's home and more than likely were delivered by a midwife, even though I did not find a single midwife mentioned in either 1870 or 1880 census. It may not have been listed as an occupation because this at that time was normal and was apparently ordinary women's work. Prior to 1938, midwives delivered approximately 90% of all births. And after that, about 50% of all births were still delivered at home by midwives. Today, midwives are well-trained and certified and attend a large portion of in-hospital births. And during my time as a medical director for Women's Clinic in Alamogordo, New Mexico, I supervised 3 well-trained midwives. Presently, Silver City has 2 well-qualified and trained midwives. Hence the dangers. So what dangers did the midwives encounter during this period of time? 96% of births, the head does present. And 3.5% of the births, it's a breech presentation, meaning either the butt comes down or the feet come down. So 0.5% of all births have a complicated nature to them. So this 0.5% definitely was an offered obstetrical calamities for the midwives. And in some cases, the undelivered child was at risk of dying, primarily because of abnormal presentation at the time of delivery. So Aaron, if I may have the first picture. The picture shows an abnormal presentation, and how is the midwife going to deal with this particular presentation? So this infant during that period of time probably died in utero, and there were other complications that related to birthing as uterine hemorrhage, related to uterine atony. There was also abnormal placental presentation, uterine inversion, or even rupture. Infection or puerperal fever caused death because of delivery in non-sterile field, and premature or prolonged rupture of membranes. Thanks, Erin. Should a problem develop during these home deliveries requiring forceps delivery or surgical intervention, these methods of solving the obstetrical issue was probably not available. And here's an example of forceps. These are Piper forceps. When I called the hospital so I could take a picture of any forceps, they were not available. Nobody could find them. They didn't know where they were. So obviously people aren't using them anymore. But just as a side note to the history of forceps, prior to 1600, there weren't forceps. What they did have was destructive instruments, because even if the baby was in vertex presentation, which was 96% of the presentation, there's still delivery could not occur. So to save the mother's life, oftentimes the fetus or the child was destroyed just to evacuate the uterus. In 1600s, almost for 100 years, up to the 1700s, the Chamberlains was a family in England that developed the forceps, and they kept this instrument completely secret for over 100 years. And after that family died down, the forceps sort of disappeared and were not rediscovered until June of 1813. So they may look like an instrument of destruction, but actually these forceps saved many infants' lives. These particular forceps are called Piper forceps. They're used in breech delivery. After the body of the baby is delivered, the forceps aspect of it helps facilitate the extraction of the baby's head. Thank you, Eric. So, so these horrible birthing events were rare, like I said, 0.5% of the time. These occurrences, these events do occur in today's obstetrical care. And what they do is they initiate surgical operating room drama for a while, and usually with good results. Infections was a scourge that affected the entire community, and was the frequent, and that was the frequent smallpox epidemics that almost occurred, that became a yearly event. The first case of smallpox was reported at Fort Bayard on May 12, 1868, when Samuel Tipton, a mail carrier from Pinos Altos to Fort Bayard, showed up at the fort deathly ill. Dr. Huntington did quarantine the patient, but in spite of good care, Tipton died 21 days later and is buried at Fort Bayard. The following month, the Santa Fe, New Mexico newspaper published a story indicating that the patient had died because of negligence. Dr. Huntington's rebuttal was precise and correcting the truth of the events. Silver City and the surrounding ranching and farming communities had two major smallpox epidemics. The first was in 1875, then again in 1877. But it seems that there was always a constant endemic level of infection. These resulted in deaths of both individuals and children. The visible signs of the infection were quickly recognized, and the proper steps of quarantine were immediately taken. In spite of this action being effective in controlling the infection, it was visibly violated. Some of these obviously infected individuals were seen about town, especially in the saloons, the dance halls, and walking on the streets. This became a serious issue that Justice of the Peace, Raialea, threatened to jail these individuals. So what has changed to the COVID-19 that we're presently experiencing? Not much has changed in that regard. Dr. Keenan, Woodville, and Kaysen, and Doc Bailey offered vaccinations to anybody, even if they could not pay. But the safety of the vaccination was still in question by some individuals. And even today, some vaccinations are questioned by individuals. An unproven method for the prevention of smallpox, and I quote from the newspaper, 1 ounce of cream of tartar and 1 quart of distilled water to be drunk when dry, close quote. Obviously, this quackery did not work, and Fort Bayard in itself was not immune to smallpox. So Fort Bayard was off limits to visitors during this period of time. And the daily stagecoach, when they approached the main gate, passengers disembarked while the stagecoach driver went in to do his business in the fort. But the disembarked passengers commingle with the guards and the other loiterers around the main gate to just violate the quarantine that they were trying to hope for. So smallpox was not the only infection that caused death, and they were typhoid fever, whooping cough, scarlet fever, and especially endemic tuberculosis. Mrs. Catherine Atram, Billy the Kid's mother, succumbed to this disease, while Mary E. Gale, age 39, according to the newspaper, died of, open quote, chronic pneumonia, close quote. That was probably tuberculosis. To get a real feel and understanding of the effects of these infectious diseases on children and young adults, visit any of the local cemeteries like Georgetown, San Lorenzo, and here in Silver City. The tombstones will tell the story. Of course, the newspaper also published obituaries of elderly individuals that one may suspect died of other causes related to diabetes, heart disease, cancer, and other chronic conditions. Silver City, as I said, did not escape the effects of quackery as illustrated by the cream of tartar prophylaxis for smallpox. The newspaper advertised Dr. Wilfang's stomach bitter pills for dyspepsia, and I'm sure you could buy them at Dr. Bailey's pharmacy. And for certain, Dr. Bailey had snake oil and other homeopathic pills, and the solutions were readily available. A newspaper notice was published advertising Dr. Blinn was to host at the Timber House a meeting that offered the cure for removal of permanent desire for alcohol. The method obviously did not survive. Then there was Owen Laubach, who presented himself in town by establishing a business at his home on Main Street, introducing a process for curing disease by vapor baths. He claimed, and I quote, "The treatment to be fast and deservedly becoming popular as hundreds of living individuals can attest," close quote. He maintained, quote, "Cure chronic diseases, although were incurable by the best physicians, that could be cured by this harmless vapor process," close quote. He gave on to explain the process. This method utilized an unknown medicine in vapor form that enters the pores of the skin and into the blood that becomes purified with no harm done to the body. He listed illnesses such as rheumatism, neuralgia, dropsy, kidney and liver disease, and other diseases that I'm not sure what they are. I guess the business was not brisk enough for Mr. Laubach, and eventually he became more involved in mining. So Aaron, if we could have the pictures of the snake oil. I don't know if they're going to come up.
It should be up, Dr. Montoya.
We have some updates that just popped up in the window. We're having some issues. There we go.
Is everyone able?
We're back.
Okay.
Go ahead.
So we were talking about quackery, and Aaron, I don't know if you brought the pictures up. There we go. This is snake oil, which was very popular during this time. Snake oil actually came from China, and it was water snakes that ate fish that had the appropriate oils and that were helpful for prevention of cardiac disease. But when Clark Stanley produced snake oil in the United States, there was no snake oil, it was purely water. And so he was found to be a complete quack. And is there another picture, Aaron, of, oh, there was some pills that were to help pale people. Yeah, the pink pills. This is all quackery. So, but what has changed to today with the COVID pandemic? Not much. You can find on the internet, you can find cures and prophylaxis for it. So in that regard, not much has changed. Thank you, Aaron. So what happened to quackery during this period of time? In January 21st, 1882, the territorial legislature introduced a bill for the regulation of medical practices. On February 4th, 1882, Dr. Keenan supported this measure to eliminate quacks because they know nothing of medicine and they know nothing of the disease. 3 months later, the governor formed the Medical Board of Medical Examination of Physicians and Surgeons and appointed Dr. Keenan as its first chairperson. This appointment speaks volumes about the qualifications of our local Dr. Keenan. So I need to tell you a little bit more about Dr. Lois Keenan. He was born on July 12, 1829 in Augusta, Georgia. His parents were born in Virginia. There's an enlistment of a Lewis Keenan on January 23rd, 1862 at Macon, Georgia, in the 1st Confederate Infantry, the Regiment Georgia Volunteers, as a rank of private. He married Irish-born Mary Agnes Brown, age 20, on June 15th, 1863 in St. Louis, Missouri. 7 years later, in 1870, he is listed as a physician living in Santa Fe, New Mexico, with his wife, Mary Agnes, and 3 children. So perhaps Lewis left the Confederacy in 1864 and eventually arrived in Santa Fe and migrated to Silver City in 1874. Mary Agnes, this is Dr. Keenan at age 71. The back of this photograph says Silver City, October 2nd, 1872. And then we have a picture of Mary Agnes. As I said, she died in 1875 of unknown causes and is buried at Fort Baird National Cemetery. If you look at the register at Fort Baird looking for Mary Agnes Keenan, you won't find her. She is listed as Dr. Mrs. Keenan. And if we would show the headstones next, the next picture. There. This is Mrs. Dr. Keenan. This is the one that's at Fort Baird. I found this by marching through the older section of the cemetery, knowing that she had to be there, but she's definitely listed as not Mary Agnes Keenan, but Mrs. Dr. Keenan. And there's no date on the tombstone to give us a clue as to when she died. The next slide shows where the headstone of Lois, Dr. Lois Keenan. He died at age 74, and this is at Grants Pass, Josephine County, Oregon. How he ended up there, I don't know. And I guess just for completeness sake, on his tombstone, his wife's name is also mentioned. So that's the story of Dr. Lois Keenan. There were some major public health issues in Silver City during our period of time that need discussion. Alcohol abuse was a very common problem, exemplified by the number of intentionally deadly shootings in the numerous saloons to which the local doctors attended. The use of tobacco was so common that it was sold in the stores by the pound. And in describing any public social gathering, the atmosphere was described as smoky and foul smelling, because we have to remember people didn't bathe on a daily basis during this period of time. The addictive properties of heroin, cocaine, and morphine also were not recognized, or if they were grossly ignored. Heroin at one time was given to children as a cough syrup. Morphine was used for women's menstrual cramps and hysteria. With this level of narcotic social acceptance, nothing is mentioned of any abuse until when the Chinese brought opium to town in the late 1870s and the early 1880s. But one of the very first doctors apparently had an addictive issue with morphine. Dr. Raglan informed his friend, Dr. Kesson, that he was going to Pinos Altos for the day. On the way, he stopped at someone's residence to get some rest, but unfortunately, this 41-year-old died of morphine overdose. Martin Bremen, one of the wealthiest men in Silver City, a three-term mayor who owned 3 of the major smelting mills and several of the most silver-producing mines, who made millions of dollars. Over a period of time, he expanded his business to Globe, Arizona. As time passed, he returned to Silver City in dire straits. He was severely addicted to alcohol, and I quote, as published in the newspaper, He was described as indulging freely in the wine cup, close quote. Additionally, morphine appears to have been a problem because he inappropriately asked Judge Given to get him 5 grains of morphine as he had been turned down at the pharmacy. During his last days in Silver City, he was a patient at the Ladies' Hospital, which he treated more as a hotel than a hospital by his comings and goings at Liberty. At 8:30 in the morning, as breakfast was being served, he developed respiratory distress. He died, showing indications of morphine poisoning that he probably obtained on the black market. He died on November 2nd, 1897, and is also buried at the Masonic Cemetery in Silver City. In the mid-1870s, a newspaper editor, O.L. Scott, informed the city fathers of the fact that the city water was contaminated. The first cemetery was near Santa Rita and 10th Streets, when it rained, the water would percolate through the cemetery ground and downhill into the city wells. The cemetery was finally moved in 1880 to what is now Memory Lane. The bodies of the old cemetery were exhumed, including those of John Bullard and Catherine Atram. A letter of complaint was written to the newspaper editor in 1881 because of dead animals, which included dogs and even a dead donkey in various states of decomposition was found on the town streets. During this time, the city council also proposed a fine of $20 for any pig found running loose in town. The town was not clean. It must have been foul smelling, not only from the dead animals, but also from the animal droppings, the toxic fumes from the smelter. So it was pretty interesting. Fort Baird, as I mentioned, collaborated with Silver City socially and culturally. Socially, they participated in the 4th of July 1876 centennial celebration. But more importantly, they made its medical facility available in certain instances. For example, in 1876, the local priest, Father Rulin, originally from France, was on a trip to the Mimbres Valley to perform his priestly duties of marriage and baptism. On his return, he took the wrong turn. I don't know why they always seem to take the wrong turn. He ended up in Pinos Altos, but by now it was dark. He was cold and wet, so as not to bother people, he took refuge in the Atlantic mine. A bite suddenly awakened him, and he attributed it to a centipede. He became deathly ill, such so that perhaps the bite was a venomous reptile, also seeking protection from the weather. Dr. Keenan and others attended Father Rulin at Fort Baird Hospital for 2 months before he died. 700 people attended his funeral. This is as much as we can scratch out of the available information, primarily from the newspapers. It just gives us a bird's eye view of the medical care in Silver City during this period of time. Better yet, in a newspaper quote on February 18th, 1882, by Dr. Keenan, who was asked about the town's health, and his response was, open quote, "The town is depressingly healthy, no diseases except rheumatism, whiskey, and laziness," close quote. Thank you very much. That concludes my presentation. So I think we have some questions.
All right. Thank you, Dr. Montoya. That was a wonderful presentation. We do have some questions, and if you don't mind hanging around and answering those. And I'm also going to launch that poll right now so you guys can take your evaluation. And so let's see, we have a question here from Sylvia Madrid. She was the first person. Would you like me to repeat the question, or would you like to hear her speak herself?
She can speak whatever works.
All right, here's Sylvia. Sylvia, are you there? Okay, well, it looks like she's not, but the question, oh, hi, Sylvia. Sylvia, are you there? Okay, it looks like the question she asked was, how would doctors back then have treated COVID-19? This is a really great question.
Well, I think the parallel to that was how they treated the smallpox epidemics, to take people that were obviously infected and quarantine them. But just like today, we're asked to wear masks, stay isolated, stay 6 feet apart, wash your hands. And but we see social gatherings where people are not adhering to those rules. So there's a parallel that as human beings, we don't like to be told what to do, I guess.
Sylvia? Sylvia, are you there? Okay. Did that answer your question? If not, you can say so. Okay. Let's see. Oh, there we are. I'm sorry, I was doing this wrong. Sylvia, are you there? All right. So next question is from Elizabeth Kaido. Let's see. Elizabeth, are you with us? Let me see. Elizabeth, are you with us?
Okay, am I unmuted now?
Yes, you are.
Okay, my question had to do with the what was called the Spanish flu back in 1818, 1819. I know that's outside of the exact time frame of this talk, but I was wondering if many Silver City people died from that virus.
Well, I wish I could answer that question, but I really can't because my research, it's very, very thorough. But I only researched through 1883. So this is way before the Spanish flu that occurred in 1918. But obviously, if it was a pandemic, I'm certain that citizens of Silver City were affected. Perhaps not as thoroughly as big metropolitan cities, you know, because currently Grant County has 17 cases, positive tests, not cases, but 17 positive tests of COVID-19. So perhaps there's a parallel to that.
Okay, thank you.
Thank you, Elizabeth. And next we have a question from Tom Hester. Did Faywood offer cures? And let me get him on. Tom, are you there? Let me see, 1 second. Hi, Tom, are you there? There we go. You have to unmute yourself. Oh, well, never mind. Dr. Montoya, the question he had was, did Faywood offer cures?
Faywood with its warm, with its hot springs, they never really pushed themselves or publicized themselves completely as a health spa like others, but people did flock to the hot springs primarily to, as they called it in those days, resuscitate. Certainly a lot of people even today believe that hot springs has curative effect, but they weren't advertised as such.
Okay. Does that answer your question, Tom? If not, you can type a response if you are unable to join us audio. Okay. All right. And,
Yes,
oh,
that
Tom, there you are. Hi.
you unmuted me now. Yeah, I was just wondering if folks drank the waters or if they just bathed in them.
Well, I think, you know, if people bathed in and then drank the water, I don't think that was a good thing to do. Or, but you know, what I can tell you is that about the hot springs, you know, that by the City of Rocks, there's history of the description of them when the international border survey was being performed. You know, they thought that the international line was going to be a higher than in latitude than where it is now. So the boundary people actually camped at Santa Rita at the mine, and on the way to the Santa Rita mine, they discovered City of Rocks, and they were totally amazed at the hot water springs and the insects that were still able to float on the hot water. But the discovery of City of Rocks and the hot springs has a very short, interesting story as well.
Thank you.
All right. Thank you, Tom. Let's see. And next up is Sterling Van de Mortel. He has two questions. The first is, where was the Exchange Hotel? And the second is, where is the Masonic Cemetery? I'm going to put him on right now. Let's see. That's live and Sterling. Hi, Sterling. Are you there with us? Hi, Sterling. Are you there? Okay, I'll just repeat that question then. His first question is, where was the Exchange Hotel?
I can't give you an exact location. It's been a while since I looked at the first city maps that I have. But the second question, where's the Masonic Cemetery? If you take the road to the animal shelter by the road by the Senior Citizen Center, if you're driving south, to the left is the large Masonic cemetery, and to the right is the Catholic cemetery. So there's two cemeteries on the same street, on the same road.
Right. Sterling, does that answer your question? Okay. If not, raise your hand and we will bring you up again. Okay, let's see. Next, we have Dr. Sparks. If anyone hasn't heard, we have another, we had another talk by Dr. Sparks not that long ago. And at the end of, in about probably a week or so, the recording of this talk with Dr. Montoya will be available, as well as Dr. Sparks we have up there at the Silver City Museum website, and we'll post that up for you to see. So Dr. Sparks wants to know if she wants to know that you mentioned heroin and alcohol and morphine addiction as problems in the 1880s. Was cocaine also a problem? Dr. Montoya. Dr. Sparks, are you there?
Yes.
Okay. That's a great picture, by the way.
Thanks.
I'd like to see that picture, Twana.
I can send you a copy. That's Mona Little. My alter ego.
Well, being an ENT doc, you're probably very familiar with the historical development of cocaine because you use that in your practice.
I know it was a component of Coca-Cola and that Sigmund Freud was a Coke addict, but I wondered, do you have any idea if it was also a problem in Silver City? Everything else seems to be.
Yeah, well, understanding the circumstances of and the availability of narcotics, I'm sure it was available at some level. I mean, if they used it, they prescribed it to children in addition to heroin for control of cough. But I didn't find any evidence per se that specific ingredient was present in Silver City.
Thanks.
All right. Thank you, Dr. Sparks. Okay, and let's see. Next we have from NSGHX. I'm not sure if this is actually a question. Maybe he'll want to elaborate on that. He just said 30 people died in the 1918-1919 epidemic. Let me see if that is, is he there? Is that true? How many people died and then, oh, maybe he was just answering. Okay, next we have Dr. Bob Lapierre. Were any large influxes of people from mining that affected the health of the community?
I'm sorry, I didn't understand the question, Erin.
Were there any large influxes of people from mining that affected the health of the community? And let me get him live here.
Yeah, I think one of the things that we have to take into consideration in that regard is that tuberculosis was pretty endemic during that period of time. So if anything was brought to this county or to the city, it certainly had to be tuberculosis. And of course, smallpox was brought in. One of the things we have to understand that during this period of time, the adults that were here, they all came from St. Elsewhere. They came from the East Coast, they came from West Coast. Nobody was born here during this period of time. It was not until 20 years later that we can say, oh, you were born in Silver City, now you're an adult. But initially, everybody was from St. Elsewhere. So yeah, they brought in their tuberculosis and smallpox and other infectious diseases.
All right. Does that answer your question?
Can I clarify that question a little bit?
Absolutely. Absolutely. Go ahead.
Okay. I asked that relative to what happened in California for the gold rush. There was a massive influx of people. And within 3 weeks, 1,000 people died of cholera in 1850.
Well, in Silver City, we didn't have any deaths of that magnitude. And so, no, we didn't have any large deaths at all compared to what was going on in California. There were just individual cases, but nothing massive at all.
Does that answer your question?
Thank you.
Thank you, Doctor.
Yeah, it did. And you can ignore the next question because it was a repeat of the first one.
All right. Thank you very much. It's great to hear from you. All right. Let's see. Next, we have a question. Roberta Direct. I'm not sure how to say your last name, Roberta. Apologize, but wants to know any idea how they treated preeclampsia in pregnant women. And let me get her on here. What else? Hi, Roberta, are you there?
I am here. Hi. Yes.
So could you repeat your question?
So I'm an obstetrician, and so I was curious about how preeclampsia was treated back then.
Well, there was no treatment for preeclampsia, as you very well know. The preeclampsia, as we know, eventually progressed to frank eclampsia, and there was high incidence of infant and maternal morbidity. The treatment of magnesium sulfate didn't come about till, I think it was 1920 at LA County Hospital, where an intern actually discovered its therapeutic effects. But no, there was no cure for preeclampsia or eclampsia at that point in time. People died.
Of course they did, but they must have rested a lot.
I'm sorry?
I bet they rested a lot.
Well, I'm sure they did, but you know, if you're toxemic, I mean, if you're eclamptic, rest isn't going to help you.
Of course not. Thank you for your presentation.
You're very welcome. Thank you for the question.
Thank you, doctor. All right. And let's see, Dr. Trinidad Tolar says, thank you for a wonderful presentation. What is used now to deliver babies that are bridged? Let me get Dr. Tolar here. Hello, Dr. Tolar. Are you there? Yes. Go ahead and ask your question.
Thank you, Dr. Montoya. It's been great hearing your presentation. And yes, from the forceps that were used in the past, are those still in use, or is there something else?
The forceps are no longer used. I think I was the last generation of obstetrician to be trained using forceps. So if there's an abnormal presentation, you know, once it's confirmed by ultrasound, you proceed on to do a cesarean section. But generally speaking, frank breech presentations, double Fulton breech presentations, they're generally delivered vaginally. And I'm certain that depends on the stamina of the obstetrician, whether he wants to endure that or just perform a cesarean section. I think what you're interested in is the safety of the mom and the baby. But no, nobody's using forceps these days. They use a suction device, and it almost sounds as bad as using forceps, but it isn't. It's significantly safer.
And how about in Latin America?
In Latin America, I think we can extrapolate what we do here in the United States in Latin America as well. You know, in Latin America and South America, they're very well trained. As a matter of fact, you know, the fetal monitor was some of the basic foundations came from Montevideo, Uruguay. So as a matter of fact, they still use Montevideo units when they evaluate or analyze the fetal tracing. So I think we can safely say that the standards that we use here in the United States are also standards that are used in Latin and South America.
Thank you so much.
Thank you. And let's see. We also, let's see. We have a few other questions. Susan Price would like you to talk a little bit more about the beginnings of the first hospital in Silver City, who started it and information on that. Would you like to hear from her?
Sure.
Okay. And let's see here. Susan? Hi, Susan, are you there? Susan? Oh, well, go ahead and answer that question.
Yeah.
Any information about the beginnings of the first hospital?
Well, if you notice in the presentation, I mentioned the ladies' hospital, and then later on I mentioned the sisters' hospital. And the sisters' hospital was founded by the Sisters of Providence that came from El Paso, that started not only the hospital, but the Catholic school associated with St. Vincent's. Eventually, I think they combined with the ladies' hospital. And as time progressed, this, over a period of time, eventually evolved into what is now Gila Regional Medical Center. But there's the initial foundation and development of the hospital. Information is pretty sketchy. You don't get any information until about the 1920s about how the hospital developed.
Susan, does that answer your question? If not, okay. There is one person, one of our attendees in this meeting had some great answers to some of those questions earlier about the location of the Exchange Motel and the casualties in the 1918-1919 flu. Would it be all right with everyone if I put her on for a moment?
Sure.
All right. Let me see here. Don't know why I cannot see her. Oh, there she is. Okay, allowed to talk. And hello, are you there? Oh, I don't think she's unmuting. Oh, there you are. Hello, are you there?
Yes.
Oh,
Hello.
great. Hi, nice to see you.
So which question do you want me to answer?
I think the first one was about the Exchange Hotel, where that was located, correct?
Yes, it was formerly the Star Hotel. The Star was owned by the Eccles family, and Timmer bought the Exchange Hotel, and they were same building but located on the corner of Spring and Hudson.
All right, and the Spanish flu from 1918 to 1919.
The official toll in Silver City is 30 people, but as we know, many more people died, as is occurring now with COVID, the official cause of death is not listed as the influenza in the pandemic. And so other people might have pneumonia listed as the cause of death, but it was pneumonia from developing symptoms of influenza that caused this.
Okay, let's see. That question, I'm not sure who asked that, but if anyone else has any more questions, please put them in the QA box or go ahead and type in the chat box down to the bottom. And we will be.
Erin?
Yes.
Is Susan Price still on?
It shows that she is, but she wasn't responding when I spoke to her. So I'm going to try to get her back on again, and you can.
I have extensive knowledge of the start of the ladies' hospital if she wants to get in touch with me.
Susan, are you there? Susan? Let's see. She doesn't seem to be able to respond right now. So why don't you respond to her in the chat? Or that's what I can think of right now.
Okie doke.
And let's see, Susan Barry, was she? Let's see. And who else has your hand up? All right. And thank you for that information. Susan Barry. And Susan Barry. Susan, are you there? Oh, I guess not. Well, let's see. It looks like we don't seem to have any more questions right now. If you do, please email me at education@silvercitymuseum.org and I will pass that along to Dr. Montoya. I want to thank everybody that took that poll, and please ask anybody who hasn't to do so now. Anyone who hasn't to do so now. Also, I want to remind you that we do appreciate any donations, and we will put that link up here shortly. Then also, the recording for this will be available on the Silver City Museum website, www.silvercitymuseum.org. And I'll put the link up for you for that here shortly. You can also please like and subscribe to our YouTube channel. That's where we keep all of these. And you'll be able to come back, and if you maybe missed something or you want to share this, and we encourage you to share this with Dr. Montoya, if this talk with any of your friends, then we encourage you to do that. Looks like there's a little bit more information here on the chat from our last speaker here about the anesthesia method. If you want to speak, please put your hand up. It looks like we have a request to talk from Dr. Trinidad again. I'm going to put her on, okay?
I just wanted to mention that I'm trying to submit the evaluation and the system doesn't allow me. I don't know if it's the same with other people.
What does it say?
It just doesn't allow me to submit it. I could put the areas where, how did you hear about this program? I could click on how I heard, but it doesn't allow me to submit.
It might just probably appear on my end. You might not have to submit it. Just click the buttons.
Okay, thank you.
But thank you so much. Anybody else? All right. All right, well, thank you again, everybody. And thank you, Dr. Montoya and Joanna. And oh, it looks like we have another person wants to speak. Okay. Let's see, here she is again. Hello.
Hey, Erin. So you had mentioned something about what I wrote in the chat. So Ed Luke was the fellow who owned the wholesale liquor store warehouse, he and his brother, and Ed was the fellow who administered the chloroform at that first surgery at the cottage hospital. And he was from Canada and was trained as a physician. So it's not simply the fact that he could get someone drunk with alcohol, that he was good at anesthetics.
Well, That's good to know. Any response on that, Dr. Montoya?
No,
All right. Thank you for the information. Okay, any other questions or anyone else want to speak? All right, well, thank you very much. And we will put those links up. And thank you again. It was wonderful. Love to hear from you. And thank you for everyone that took the poll, for showing up, that has engaged with us and asked questions. And of course, special thank you to Dr. Montoya for this wonderful presentation, as well as Melody for helping out with some technical concerns, and Joanna Lutz for helping moderate and putting all the wonderful promotion out there. Also, please like us on Facebook, donate at www.silvercitymuseumsociety.org/fundraising. And also, if you go to the website, www.silvercitymuseum.org, and go to events and programs, you'll be able to see all of our upcoming programs and also the recordings of past events, including